Thank you so much.
Thank you. I think with this, we'll move on to the next case.
Right, sure.
Can we have the slide, please? The next surgeon is Dr. Sartaj Grewal. I would request Dr. Rajesh Sinha to please introduce.
Sartaj is a young, dynamic surgeon who is has now become well-known cataract and refractive surgeon at Grewal, working at Grewal Eye Institute. He has been trained at RP Center and has been trained at various other institutions as well. He is a very skilled surgeon and has been presenting in many national and international conferences and has done live surgery as well. So Dr. Sartaj will be operating on a patient who is 67-year-old female.
Yes, sir.
And IOL power is 23.5. The right eye that is to be operated, grade 3 cataract. Machine is again Quattro 700. IOL is CT Lucia 621P. And he'll be using MyLoop. I believe, Sartaj, you are a fan of MyLoop, and very often you have presented also on MyLoop, and you keep using MyLoop very frequently.
Yes, sir. So thank you so much for the kind introduction. So we'll be dealing with pretty much the entire Zeiss cataract suite today, sir. Starting with, the biometry that's been done on the IOL Master 700. Then all the data was calculated using the EQ workspace by Zeiss, where everything is done paperless. All the calculations are done easily. Then all the data is transferred onto the Callisto, and now the Callisto communicates with the Artivo. So we have all our readings, even the patient data, even the lens data on the screen that I can see anytime during the surgery. And that's also linked with the Quattera, which again shares the patient data. And it's actually very easy now to control the entire surgery workflow through the Quattera, because you can start with incisions, then capsulexis, then scald, quad, and the subsequent steps. You just control them right from the phaco foot pedal. If you have a toric, you can use Z-line also straight from there. So it's very easy, rather than having someone who has to go and register the Callisto data or do the Z-line toric and everything. Now you just do it with your foot pedal, the same one you're using for the phaco machine. And as far as the MyLoop is concerned, yes, I have been using that for about over 2 years now, 3 years, and I am a big fan of the MyLoop. The case we have today is not very hard. Generally, I do prefer to use a MyLoop when it's a very hard cataract, but this one is pretty okay. But still, I think it'll make things easier if you go ahead and use that.
So there's one question. You talked about the workflow, the cataract workflow that Zeiss has for planning the data, and you can all link it together. I just wanted to know, suppose somebody doesn't have you say Callisto, but has a Verion, or has some other, doesn't have, say, IOL Master, but has a Lenstar. Can that also be integrated into that workflow station?
No, ma'am. No.
So it has to be all Zeiss then?
Yes, it's like Apple. If you have Apple Watch, you have
so
Apple
you have
phone.
all Apple, or
yes,
if you're Windows, then you're all Windows. Okay.
Yes, it's how heavily you're invested in one.
But then what about the machine? The machine, I believe you can use any. You're not.
You can use any. You can obviously use any one. Yes, you can use any one single part of the whole ecosystem, but I think the magic really happens when you use all of it.
So if you have to, if you are, say, a new surgeon who's investing into things, then you invest into all Zeiss or no Zeiss. It's something like that.
I think that's a very variable and subjective question. I think it makes sense to, I would invest first and foremost. The two things wherever possible, would be a good microscope and then a good phaco machine. I think those are for at least an anterior segment surgeon where the difference really comes in.
And a good biometer, I think.
And a good biometer, actually, yes. I would say microscope, biometer, then phaco machine.
So Sartaj, any issue in using MyLoop in soft cataracts?
No, sir. In fact, many times when I have patients with poorly dilating pupils or IFIS, I actually prefer using the MyLoop, particularly if it's a softer cataract, because sometimes in that it becomes very difficult to really, be able to chop that nucleus in that limited space that you have. So I find that the MyLoop works wonderfully in those situations. So soft cataracts, small pupils, I found the MyLoop to be a very sort of diverse tool that is useful in a variety of situations.
Very nice view, microscope view we could just now see. It's a beautiful view, and I'm sure the use of MyLoop will also be seen very clearly.
Yeah, so definitely, like usually I'm using MyLoop in very dense cataracts where I can't see anything that's happening behind. So this should be a little different. Let's see. So I like to inject a little bit of xyloadri mixture to just keep the pupil nice and dilated. As far as viscoelastic is concerned, for most of my cases, I just use HPMC 2%, and I'm very happy with it. Even with the MyLoop, I do prefer viscodispersive viscoelastic devices. So I do prefer to use a 30 gauge needle for the capsular excess. I feel it just gives me better control. Not to mention, I feel that in the surgical videos, the proportions actually come out looking a little better, looks a little neater. But it just gives me, it's a lot easier to maneuver inside the eye. So using a 2.4 millimeter main wound. Going to do hydrodissection, and some hydrodelineation, MyLoop. So when I started using the MyLoop, it was the original version. The original version did not have this little rubber sleeve at the end. So when I'm using it, I actually prefer to remove this. Personally, I'm a little more comfortable with it like that. But it depends. If you're starting off new, you can use it with that. So I like to start off by just gently injecting the loop, then going in, making sure you're underneath the capsular excess margin, open it up, get it around, chop. Then we can go ahead. I do like to make 4 quadrants. Again, this is a relatively softer cataract, so you could probably get away with just 2. But I do like to use 2 instruments to rotate the nucleus into position for the second divide. Form the chamber every time before you're going in to use the MyLoop. It is important. You need space. Again, you just first inject the loop, go in, open up gently, go around, and there you go, 4 pieces. So one very interesting feature that this machine has actually is automatic continence irrigation. So if I just enter the eye and press the foot pedal, continence irrigation is on automatically, and I actually find that to be very convenient. So with 4 pieces here already, I can just go ahead in quad, start emulsifying the pieces. Again, you can see 660 vacuum, 671. It's so stable. This machine is, even with this dense cataract, it's just eating it away. So I am using the machine in what is advanced power modulation mode. I do prefer to keep the phaco setting a little higher because yes, we have only longitudinal phaco. We do not have any kind of torsional or elliptical. But again, the fluidics are such that you don't miss that. Even what is a relatively dense nucleus, you can see it just goes ahead and emulsifies it. The best part is you don't need to move the phaco probe. You just keep it in the center and everything just keeps coming. Just look at that. All the pieces, just it attracts them like as if it's a magnet pulling in iron files. It's amazing. See, last piece, I can go ahead. I'm not worried about the chamber collapsing. So I like to do a little hydro polish. Even I am partial to the bimanual. So this bimanual is actually the single-use bimanual system that comes with the machine. It's by Zeiss itself. I like it quite a bit. The pores are good. The tip is again actually sandblasted, so it's nice and gives you a rough finish for polishing the capsule. Especially when you're doing surgery in cases that have undergone flax, these cortical fibers can be very difficult to remove. So I find that bimanual is very helpful for such cases.
So Dilraj, wonderful, Sartaj, wonderful job done.
Thank
so
you.
we have with us Dr. Supriya from Bangalore.
Yes.
She has extensive experience and she's going to talk to us today about MyLoop. So I'll
Yes.
ask her to make some comment on this. Supriya.
Hi, Sartaj, Supriya here.
Hi,
Excellent
Supriya.
surgery, excellent
Thank
use of the
you.
MyLoop device.
Thank you.
Yeah, soft cataracts can be a little tricky with this one. And I completely agree with you about the Gen 2 MyLoop and the bellows. Even I found it a little bit restrictive, and it's a great idea to, use it without that if you're used to the Gen 1. So great
Yes.
tip there. Yeah.
Rajesh, your experience about MyLoop?
No, I don't have any personal experience of MyLoop.
Sir, I've used MyLoop in heart cataracts in about 10 cases. All of them did well. The only thing is that there's an expense to it. And so the patient has to pay for it. So that is the only limiting factor of using it. Otherwise, I think it works well. And especially for heart cataracts, it's a great device.
Sartaj, I'm sure you must have experience of, comparative evaluation of MyLoop vis-a-vis the phaco in terms of endothelial loss, in terms of phaco power used and other things.
So I would not have actual data to provide. I would just have anecdotal experiences to share. When you do surgery on these patients with these very dense cataracts, the vision preoperatively is obviously very low, and their expectations after surgery are actually fairly high. They expect that they haven't seen in quite some time. They would like that the day after surgery, they come in and they're able to see. Now, when you do just conventional phaco in these patients, the corneal edema is so severe that they really can't see much on day one and they tend to be quite disappointed. With the MyLoop, I've found that the cornea is quite clear on day one, and these patients are just so happy because they've gone from these very dense cataracts with low vision to being able to see everything on day one. So just that experience in itself with these patients on day one is worth it. And again, most of these patients, they are fairly aware that they have a very dense cataract. They've probably been advised surgery earlier, but they delayed it for whatever reason. So many times they are actually quite open to the idea of using some device or some technology that actually helps them. So in my experience, again, I'm quite happy.
Is MyLoop your choice in all cases?
Not in all cases, but any dense, any relatively complicated case, yes, I have a very low threshold for using the MyLoop. And I've actually seen, some of the insurance companies and even the government agencies, they'll actually reimburse the cost of the MyLoop. So
I was coming to that only. What about the
yes,
economics of this?
yes. So that again is a big help with some of these patients that they are able to, transfer that cost onto their insurance companies.
So is GIPSA or ADA reimbursing all these things?
Yes, well, not in every instance, but yeah, I've had patients, ECHS patients, CGHS patients, and a couple of private insurance patients who have gotten reimbursement for this procedure.
So can I ask you a direct question, if you don't mind?
Sure, sir.
How much do you charge extra for this?
So good question, sir. So I actually really believe in the device, and I really feel it helps me deliver better results. So I have kept a very minimal sort of margin on it. I have given it as an advantage to the patient. I give it at just maybe 1,000, 2,000 rupees more than what the cost price is, not more than that.
That's perfectly okay. I think 1,000 will
Yeah.
nothing. So congratulations on excellent job done.
Thank you,
I really
sir.
enjoyed your surgery, and usage of MyLoop was like like cutting through a butter actually. Very
It
nice.
actually, it really is. Like the first time I remember I used the MyLoop was in a very dense cataract. And the minute, I was very apprehensive that how much force will be required to really cut it. And when it cut it, it was literally like a warm knife going through butter. And I really debated. I was like, like with phaco ultrasound energy, you're just sitting there and emulsifying it constantly, or even chopping those leathery cataracts. You have to do it in multiple planes. This thing does it as if it's nothing. It's amazing.
So one question which was bothering me was, firstly, you cut it into two.
Yes.
Then you engage the MyLoop into both the pieces and then cut into four, or rather one by one.
Yes.
Both the pieces.
Yeah, so you just rotate it. You leave it a little under rotated because sometimes as you're opening the loop, it tends to rotate a little bit because of that also. Again, with softer cataracts like this one, you could just do two pieces and take it out. But with the harder cataracts, I prefer to always make four pieces and then remove it.
Let me ask our guest speaker, Dr. Miguel, you have any comments here? Dr. Miguel, yeah.
Miguel.
Any comments on this usage of MyLoop? You saw this beautiful surgery from Chandigarh just now.
Sorry.
Do you have any experience of using MyLoop?
With MyLoop? No. Normally in Portugal, nobody uses MyLoop. We have dense cataracts, but the prevalence is not as big as yours. So normally we use techniques like the direct chop or horizontal chop or vertical chop is the most used techniques in there. I have some experience with the Quatera, and normally I use Centurion or the Stellaris machine.
But your reaction to what I was wondering?
And for me, the big difference between the Quatera, is the phaco on demand and the pump that permits, if you see, you can get the vacuum to almost 700 millimeters. And the expiration rates are much higher. The surgery is faster with big security. When I use it before it was launched, I noticed immediately that characteristics.
So, but you saw a wonderful surgery done just now. Your comments on this surgery done.
Sorry.
Your comments on this surgery done just now.
Yes.
About the surgery.
Okay. The surgery. Oh, I found it very nice, very easy, a little bit. The way that when he introduces the MyLoop through the Rex is, for one that hasn't, I have seen it already, but for the people, I think the learning curve, I imagine there's some learning curve, I think. Am I right?
The learning curve with MyLoop is basically just twofold. Number one is learning to get it through the incision, because sometimes that can be a bit tricky. Sometimes you can end up damaging the endothelium. And secondly is learning to just get it underneath the capsular rhexis. Once you have that, well, three things, I guess. The third thing is actually how you open it is not a single motion. It's a combination of opening it and looping it around the nucleus. So basically you're doing both those things, and you're looking for movement of the nucleus. If the nucleus is moving as you're rotating it, that means open the loop wider. because otherwise it's just pushing it, and if you open it too wide, you'll see that the rexus margin actually becomes oval, so you don't want to put too much stress on the rexus margin. So it's basically learning that movement of opening it, rotating it at the same time, and getting that feedback that the nucleus is stable and it's actually engulfing it. But
Sartaj, how many times you can reuse it?
It gives you about 5 cuts.
And how do you sterilize?
ETO.
ETO.
Yes, but the idea, so the first generation MyLoop was reusable. It did not have any lock on it, and I used
think,
that.
yeah, I was about to say that now there's a lock on it and you can't
Yes,
you
yes.
can't reuse it.
But from experience, I'll say actually it's not a bad thing, because at the end of the day, this is a metal. It's a filament. It has memory. It tends to undergo stress. Sometimes you can have breakage. With the original one, I actually had a problem. It broke. So I feel the idea of keeping it single use, yes, monetary cost is in our country especially, there are issues, but it is safer.
So I think the first generation that we all used, at least for 4 times, it was quite okay. I mean, there was no problem.
True.
But the second generation, you can't use it. They have very cleverly locked it.
Yes.
That's a business trick, actually. You see, if you lock it, that's a business trick. But
Yeah.
but my question was, first case and fifth case, the feel is same to you?
Yes, the feel is the same. If anything, actually, it's better after the first.
Chal.
It
Okay.
opens up. But again, the thing is, it will give you 5. So if I am doing it into 4 pieces, that means I can use it in 2 cases. If you're going to divide it only into 2 pieces, then you can probably use it in about 4-5 cases.
Chal, congratulations, both SPS as well as Sartaj. Excellent job done, and we had a very nice view here. Excellent view on each fiber, and congratulations to the entire team. We can see your staff also; they've done an excellent job, and all the machineries and all very nicely. SPS, congratulations.
Thank you.
Thank you so much, sir, for